And three Ontario regions, Ottawa, Peel Region, and Toronto, are moving back to a modified stage 2. The province is asking people to stay home except for essential trips. Why did Ontario wait so long? Dr. Abdu Sharkawy, CTV News infectious disease specialist, joins me now. Dr. Sharkawy, as usual, nice to see you. I'm wondering if a few weeks ago, even a month and a half ago, you were watching people, you were seeing what was going on. Did you kind of predict that we would be here now? As a doctor and as a specialist, did you think that this would be our fall? And I mean the season fall.
Unfortunately, I did. I very much remind myself, when our COVID ward closed, towards the beginning of July, and I recall speaking to my colleague saying, we'll be back in September, and he sort of raised his eyebrows and thought, seeing the glass half empty. But unfortunately, this is a predictable consequence of a pandemic. There's never been a pandemic in recorded history that hasn't had a second wave. We know that there were all kinds of challenges that we had to encounter in terms of opening up schools and having the economy become unrestrained again. And this was inevitable. And it's just really unfortunate that it's taken this long to identify the situation when we're nearing a crisis within our healthcare system to make the necessary adjustments. I hope this is a turning point that we can all learn from and mitigate the damage going forward.
I know it's a turning point, and what they're telling us now here in Ontario and in Quebec, it's 28 days and then we'll see. But we know that in 28 days, the curve may, have sort of come back down in a more manageable curve. But the minute we reopen, this is going to be sort of the loop, is it not? If we reopen, there are going to be more cases. But if we don't reopen, the economy will go sideways.
Yeah, this is the challenge that we're really going to have to deal with for the foreseeable future, quite frankly. And I think if we can learn one lesson from the first wave, is that we have to be careful about easing restrictions in environments that lend themselves to transmission of this virus more readily. I can tell you I was rather alarmed just visiting a restaurant, almost a month and a half ago, and seeing the number of people inside, obviously unmasked. It's a recipe for trouble. I think that you've got to be intelligent and thoughtful about the design of how we're allowing indoor business to be conducted and how we allow things to be done safely so that the economy doesn't necessarily get completely hamstrung, but at the same time, we take care of the health and safety of our community. And that's something that I think we really need to be mindful about going forward. I do think a targeted approach is the right way to go now to avoid blunter instruments from being used in the future.
So, what are you seeing as these cases, increase, as the number of people who are getting sick, unfortunately, and those who have to go to hospitals are increasing? What are you seeing in hospitals? Because politicians are telling us our healthcare system has to be protected and managed. Is it still manageable, what you're seeing?
Well, it's manageable from the point of view that we don't think that there have been situations that have led to very unsafe outcomes. But, that's not the goal that we should be striving for. We should be striving for optimal care for all of our patients. And let's be honest, that didn't happen after the first wave when a lot of people were denied the care that they needed. A lot of surgeries were delayed. A lot of people didn't seek medical assistance because they were concerned about the safety of hospital and medical environments. And we can't forget that. We've got to remind ourselves that there is a lot of health morbidity and issues out there that need to be dealt with that are non-COVID related. We can ill afford to have those suffer along with COVID cases on the rise and the flu season just awaiting us now around the corner. So I think that we have to be very mindful of the fact that our healthcare system at a baseline level is already very stretched. It's often near capacity. And we want to do everything that we can outside of the hospital within our communities to not push that envelope to an unsafe level.
So I don't have a lot of time left, but I want to ask you this. So there are by-elections in Toronto. in York Centre and Toronto Centre, two by-elections. One of the candidates, the Green Party, the new Green Party leader, asked the Prime Minister to cancel them or to postpone them, given the situation right now. Is it safe to have two by-elections in Toronto, as the city is knowing has a record amount of cases?
I don't think it's ideal. Certainly, if you're talking about having people line up in close proximity to one another, if it's not something that's absolutely critical, I think that should be postponed. This is not the time to do anything that is non-essential, and I would think that that should be the point of view that we should be taking going forward.
Dr. Abdu Sharkawy, as usual, thank you so much for being there. I know you're a busy man, and have a wonderful weekend and happy Thanksgiving, sir.
Thank you. Happy Thanksgiving to you too. Everyone stay safe and make it a small Thanksgiving.